C. Colonic fluid. D. Cathartics. Correct answer. A stoma or ostomy is a surgically created opening on the abdomen which allows stool or urine to exit from the body. The output from the stoma regardless of the type of stoma is called effluent. At the health fair, the nurse teaches the client and #039's spouse how to take the blood pressure. According to the nurse, when is the correct time to note the diastolic blood pressure reading? A. When the last loud knocking sound is heard. B. When the swishing sound becomes loud. C. When the loud knocking sounds become muffled. D. When the swishing sound becomes faint. Correct answer. The point at which the last sound is heard before a period of continuous silence, known as phase 5 of Korotkov sounds, is considered the best reflection of adult diastolic pressure. In some cases, two diastolic pressures are recorded, the pressure at which the loud knocking sound becomes muffled and the pressure when the last sound is heard. The nurse is evaluating the client and #039's pulmonary artery pressure. The nurse is aware that this test will evaluate A. The pressure in the right ventricle. B. The pressure in the pulmonary veins. C. The systolic, diastolic, and mean pressure of the pulmonary artery. D. Pressure in the left ventricle. Correct answer. The pulmonary artery pressure will measure the pressure during systole, diastole, and the mean pressure in the pulmonary artery. It will not measure the pressure in the left ventricle, the pressure in the pulmonary veins, or the pressure in the right ventricle. Therefore, the answer in quat, pressure in the left ventricle and quat, the answer in quat, the pressure in the pulmonary veins and quat, and the answer in quat, the pressure in the right ventricle and quat, are incorrect. While caring for a client with hypertension, the nurse notes the following vital signs: BP of 140/90, pulse 120, respirations 36, temperature 100.8 and DEG, F. The nurse and #039's initial action should be to A. Obtain an ECG. B. Obtain arterial blood gases. C. Recheck the vital signs. Correct answer. Concentration of oxygen in expired air is about A. 16%, B. 0%, C. 21%, D. 4%. Correct answer. Concentration of oxygen in expired air is about 16% and inspired is 20%. Sharp instruments should not be sterilized by A. Hot air oven. B. Boiling. C. Autoclaving. D. Antiseptic solution. Correct answer. What type of isolation precaution is in use when a patient is asked to wear mask? A. Droplet. B. Blood safety. C. Contact. D. None of these. Correct answer. Allen and #039's test checks the patency of the A. Carotid artery. B. Ulnary artery. C. Radial artery. D. Correct answer. Deep palpation is used to assess which of the following: A. Hydration. B. Skin turgor. C. Temperature. D. Organs. Correct answer. Nurse working in an operation theater must know the risk of HIV infection with needle stick injury is about. Correct answer. How long should a nurse wait after taking cold milk for recording oral temperature? A. 4 to 5 mts. B. 20 to 30 mts. C. 10 to 20 mts. Correct answer. The most common deficiency seen in alcoholics is A. Riboflavin. B. Thiamine. C. Pyridoxine. Correct answer. Goniometer is used to assess A. Muscle strength. B. Auditory occulty. C. Visual occulty. D. Range of motion of joint. Correct answer. Which of the following is considered as the most important aspect of hand washing? A. Water. B. Soap. C. Friction. D. Time. Correct answer. Lactated ringer and #039's solution is contraindicated in A. Lactic acidosis. B. Hypovolemia. C. Correct answer. Ringers lactated not used for treatment of lactic acidosis or severe metabolic acidosis. In Maslow and #039's hierarchy of physiologic needs, the human need of greatest priority is. Correct answer. Socialization into 1 and #039. S primary culture as a child is known as. Correct answer. The nurse is preparing to take vital sign in an alert client admitted to the hospital with dehydration secondary to vomiting and diarrhea. What is the best method used to assess the client? Correct answer. Tonicity of ring or lactate is A. Hypoton. Correct answer. Endoscopic catheters are sterilized by A. 2%. Correct answer.